and welcome to Tracking COVID-19. I'm Rukma, and over the next half hour, we track all the national and international developments on the coronavirus outbreak. In a mega operation, India has made a detailed plan to evacuate fellow citizens who are stranded abroad, while within the country, the first trains transporting migrant laborers home have left their stations. Meanwhile, in the US, which is one of the worst affected, President Trump has said that the White House coronavirus task force would wind down. Other countries in the West too are working towards reopening their economy slowly. All that and more. First up, the headlines. Leading an all-out war against COVID-19, Prime Minister Narendra Modi chairs task force meet to discuss progress in India's efforts in vaccine development, drug discovery, diagnosis and testing. Over 30 Indian vaccines are in different stages of vaccine development, with few going on to trial stages. Biggest ever evacuation exercise by air and sea begins tomorrow to bring back around 15,000 Indians stranded abroad, 64 flights and 3 naval ships to ferry them back from 13 countries in 7 days. Only asymptomatic passengers allowed to travel. Group of ministers led by Union Health Minister Dr. Harsh Vardhan holds COVID-19 review meeting for 14th time since February, had in-depth deliberation on containment strategy and management aspects of COVID-19, as well as measures being taken by the centre and various states. Centre says no exams to be held for CBSE Class 10 board exams for 2020 nationwide except for students from Northeast Delhi. JEE mains to be held from 18th to the 23rd of July, while NEET to be conducted on 26th July. JEE advanced exams to be conducted in August. Total active cases of COVID-19 in India stand at 33,514. while 14,182 cases have been discharged, 1,694 casualties recorded so far. Coronavirus cases across the world stand at over 36 lakhs, more than 2,57,000 deaths reported so far. US reports more than 12 lakh people infected with COVID-19 and nearly 71,000 fatalities. And let's first take stock of the developments in India and Ground Zero. Prime Minister Narendra Modi on Tuesday chaired a meeting of the task force on corona vaccine development, drug discovery, diagnosis and testing. The Prime Minister took a detailed review of the current status of India's efforts in vaccine development, drug discovery, diagnosis and testing. Over 30 Indian vaccines are in different stages of corona vaccine development, with a few going on to the trial stages. Similarly, in drug development, 3 approaches are being taken. First, the repurposing of existing drugs. Secondly, the development of new candidate drugs and molecules are being driven by linking high-performance computational approach with lab verification. Thirdly, plant extracts and products are being examined for general antiviral properties. In diagnosis and testing, several academic research institutions and startups have developed new tests. The review by the Prime Minister took note of the extraordinary coming together of academia, industry and government, combined with speedy but efficient regulatory process. The PM desired that such coordination and speed should be embedded into a standard operating procedure. He emphasized that what is possible in a crisis should be a part of a routine way of scientific functioning. PM Modi suggested that a hackathon be held on the subject, linking computer science to synthesis and testing in the laboratory. The successful candidates from the hackathon could be taken up by the startups for further development and scaling up. He added that the innovative and original manner in which Indian scientists from basic to applied sciences have come together with industry is heartening. This kind of pride, he said, originality and sense of purpose should dominate our approach going ahead. He said it is only then that India can be amongst the best in the world and not a follower in science. It's called the Vande Bharat mission and is all set for takeoff from tomorrow. standard operating procedures for the world's biggest ever evacuation plan have been worked out. Civil Aviation Minister Hardeep Singh Puri has announced the first phase will commence over 1 week starting from Thursday, under which 64 flights will be operated. Lists of evacuees have been prepared by Indian missions abroad, and the flights would have reasonable charges. Under the mission, the flights between 14 Indian cities and 12 foreign countries will bring back 14,800 people in the first phase.
Comprehensive plan has been drawn up to address the particular issue of those of our citizens who find themselves distressed and have been stranded in foreign countries. Let me just give you an indication of the number of flights that we are planning to mount during the first week of the resumption or the commencement of this operation. And I mean the period between May 7 to May 13th. We have worked out those details, and these involve 10 flights from the UAE, 2 flights from Qatar, 5 flights from Saudi Arabia, 7 flights from the United Kingdom, 5 flights from Singapore, 7 flights from the United States, 5 flights from Philippines, 7 flights from Bangladesh, 2 flights from Bahrain, 7 flights from Malaysia, 5 flights from Kuwait, and 2 flights from Oman. This brings the total number of flights that will be operated during the first week to 64.
External Affairs Minister Dr. S. Jaishankar also tweeted about the Vande Bharat mission in a series of tweets along with images of his efforts together with other officials to coordinate the arrivals during the first phase from the 7th to the 13th of May with the state governments involved. He also urged all Indians stuck abroad and wishing to return home to remain in regular touch with their respective embassies and high commissions. He expressed confidence the collective efforts will make the mission successful. And the Indian Navy too has launched Operation Samudra Setu, meaning sea bridge, as part of the national effort to repatriate Indian citizens from overseas. Indian naval ships Jalashwa and Magar are presently en route to the port of Malé in the Maldives to begin operations from 8th May as part of Phase 1. The Indian mission there is preparing a list of Indian nationals to be evacuated. A total of 1,000 persons are to be evacuated in the first trip. The ships have been suitably provisioned for the operation with all basic amenities and medical facilities during the sea passage. Stringent protocols have also been stipulated. The evacuees will disembark at Kochi and be taken care of by state authorities. The operation is being progressed in close coordination with Ministries of Defence, External Affairs, Home Affairs, Health and various other agencies of the Government of India and state governments. And as we were telling you, the Navy has launched Operation Samudra Setu, that means sea bridge, and to evacuate Indian nationals stranded in the Maldives. And the operation is in close coordination with various ministries. Moving on now, the Indian missions in the Gulf nations are working overtime to facilitate the evacuation of Indian nationals. Our correspondent Kanchan Prasad has more details.
Amidst the global pandemic, the Indian missions in the Gulf countries are preparing for a major operation for the evacuation of the Indian citizens, the distressed Indian citizens, from 7th of May 2020. the consulate officials, the embassy officials, along with the community participation and volunteers, are working day and night on a war footing, I would say, to prepare the list of the distressed citizens. Priority is being given to the workers in distress, the pregnant women, those who are elderly, those who require urgent medical attention, and others who are stranded in difficult conditions. The embassy consulate is in the process of contacting people through emails and phone calls. For the Gulf countries, in the next 1 week, 25 flights will be made operational. 10 from UAE, 5 each from Saudi Arabia and Kuwait, and 2 each from Oman, Bahrain and Qatar. Close to 5,000 Indians stranded in these countries amidst the coronavirus outbreak are expected to return. Airlines will follow the standard operating procedures, and only those people will be allowed to travel who are found asymptomatic.
Meanwhile, the Home Ministry has issued SOPs that standard operating procedures for movement of Indian nationals stranded outside the country, and also for those stranded in India who are desirous to travel abroad for urgent reasons. As per the SOPs, the priority will be given for travel from abroad to compelling cases in distress, including migrant workers who have been laid off, people faced with expiry of short-term visas, those with medical emergency, pregnant women and the elderly will also be given priority. The cost of travel will be borne by the travelers. Before boarding, all travelers will give an undertaking that they will undergo mandatory institutional quarantine for a minimum period of 14 days on arrival in India. At the time of boarding the flights, all travelers will undergo thermal screening and only asymptomatic travelers will be allowed to board. The passengers will have to register on the Arogya Setu app during the journey. All passengers will have to follow social distancing and hygiene protocols. On arrival in India, they will be screened, and passengers found to be symptomatic will be immediately taken to a medical facility. If they test negative after 14 days, they will be allowed to go home and will undertake self-monitoring of their health for another 14 days as per protocol. The SOPs for persons stranded in India who are desirous to travel abroad for urgent reasons that say that they will have to undergo thermal screening, and only asymptomatic passengers will be allowed to board the flights. They will also have to follow the health protocols. The cost of travel will be borne by travelers. The 14th meeting of the high-level group of ministers on COVID-19 was held on Tuesday in New Delhi. A detailed presentation on the present status of COVID-19 cases globally and within the country was made to the GOM, chaired by Union Health Minister Dr. Harshvardhan. The GOM had in-depth deliberations on containment strategies and management aspects of the disease, as well as the measures being taken by the centre and various states. The GOM was apprised that as of now, the death rate is around 3.2%, while the recovery rate is more than 25%, which may be taken as the positive effect of the lockdown nationwide, along with cluster management and containment strategy. Hyderabad-based Centre for Cellular and Molecular Biology will attempt to grow novel coronavirus in human cell lines, which will enable in vitro testing of potential drugs and vaccines against the deadly virus. The research team will use iStem's human lung epithelial cell culture system provided as part of the anti-COVID screening platform to understand the molecular and pathological characteristics of novel coronavirus, with a view to establish a rational basis for testing potential drugs in vitro. According to Rakesh Mishra, Director, CCMB, culturing the virus outside the human host is a technological challenge that needs to be overcome. iStem cell culture system expresses the ACE2 receptor and other genes that are key determinants of viral entry and replication. CCAMP is an initiative of the Department of Biotechnology, Ministry of Science and Technology. iStem is working to democratize access to cell therapy as well as disease modeling platforms and bring their benefit to a large section of humanity. The developers of the Arogya Setu app have issued a statement saying that there was no security vulnerability in the contact tracing application. In a statement issued on Twitter, Arogya Setu has said that they are continuously testing and upgrading the systems and no personal information of any user has been proven to be at risk. The team assured everyone that no data or security breach has been identified. The government has mandated public sector and private sector employees who go to offices to download the app, as also people who are in the containment zone, localized areas where there is a COVID-19 positive case detected. Busting all rumors regarding a form in circulation on WhatsApp groups with a title, Rescue Flights from India for Stranded Indians, the government has clarified that it has not issued any such form. It has also advised people to abstain from clicking on these links and register only from official websites of embassies. And let's now take a look at the latest update of COVID-19 cases from across the country. Active cases of COVID-19 have gone up to 33,514 as per latest updates. 14,182 people have been cured or discharged till date, while 1,694 people have lost their lives. Maharashtra continues to be the hardest hit with a total of 15,525 cases. Gujarat has reported 6,245 cases, while 5,104 cases have been reported in Delhi. And even during these times of crisis, news filled with goodness are coming from around the country. Let's take a look at good news on tracking COVID-19. Human Resources Development Minister Ramesh Pokhriyal Nishank has announced that joint entrance exams JEE Mains will be held from 18th to 23rd July, while the JEE Advanced will be held in August. Interacting with students from across the country, the HRD Minister said the dates of these exams will be announced soon. Nishank also said the National Eligibility Cum Entrance Test NEET will be held on 26th July. HRD Minister also informed that no exam will be held for CBSE Class 10 for 2020 nationwide except for students from Northeast Delhi. He also said that exams for 12th class will be conducted only for 29 main subjects. The exams were postponed due to the lockdown imposed in the country to combat COVID-19. And amidst the lockdown 3.0, employment activities in rural parts of Bihar are getting back on track. Under Mahatma Gandhi Rural Employment Scheme, a lot of work is being executed in different districts. Work that was stalled following previous lockdowns. In Nevada district, more than 35 workers are employed in digging ponds following the norms of social distancing. They have also been provided with masks as precaution against spread of the disease, and taking their meals are also being taken care of. Authorities have provided them with cereal and have also made efforts to cater to their financial needs. They get a daily wage of 194 rupees. Panchayat Technical Assistant Avinash Kumar Nirala has said the workers are receiving their wages every 14 days. In Aurangabad district, 8,000 families in 200 panchayats have received employment under the scheme. They are also following the norms of social distancing. And amid the lockdown over COVID-19, various organizations are coming forward and playing their part to help people to tackle the situation. Trivandrum Corporation Employees Union also distributed nearly 25,000 grow bags to the public in order to promote vegetable farming during the lockdown. In the tribal-dominated areas in Maharashtra's Nashik district, ASHA workers are working round the clock to spread awareness about coronavirus. The ASHA workers have been carrying out door-to-door awareness drives, giving lessons to people on hand washing, social distancing and wearing masks. And the cluster approach of the centre seems to be benefiting people amidst the coronavirus pandemic. The method is useful in increasing productivity of small and micro enterprises. Osmanabad district of Maharashtra is benefiting greatly from the approach. Women of Alam Prabhu garment cluster in the district are making masks and PPE kits on a large scale. A group of 60 women are carrying out the work from the past 2 months. So far, 2 lakh masks have been manufactured by the group, thus not only catering to the needs but also strengthening themselves in these testing times. And let's now scan through the developments from across the globe in World Wrap. And ever since the news and reports of the spread of the virus emerged from China's Wuhan city, the virus has spiraled. Cases of the virus have spiraled. So far, it has gripped more than 180 countries worldwide. As far as the infection toll is concerned, the total number of confirmed cases has risen to 36,63,824. 2,57,288 have succumbed to the disease. Countries adopting lockdown to prevent the spread have seen a decline in cases. Many countries have extended the lockdown. Others are gearing back to normalcy with the adoption of social distancing measures. The Trump administration has initiated talks on winding down the White House task force on coronavirus and gradually delegating the responsibilities to the relevant federal agencies. U.S. President Trump has confirmed the White House coronavirus task force will be winding down as the country moves into a second phase of dealing with the aftermath of the outbreak. The toll from the pandemic has surpassed 71,000 in the U.S. with more than 12,03,673 cases of infection. The U.S. death toll is the highest in the world.
We can't keep our country closed for the next 5 years. You know, you could say there might be a recurrence, and there might be, and you know, most doctors or some doctors say that it will happen, and it'll be a flame, and we're going to put the flame out. We've learned a lot. You know, we've learned a lot about the coronavirus. We've learned a lot about this hidden enemy. It's a dangerous enemy. It's a bad enemy.
And the UK has overtaken Italy in reporting the highest official death toll from the new coronavirus in Europe. Figures released on Tuesday showed increasing pressure on Prime Minister Boris Johnson over his response to the crisis. Weekly figures from Britain's Office for National Statistics added more than 7,000 deaths in England and Wales in the week to April 24th, raising the total for the United Kingdom to 32,313. Only the United States, with a population nearly 5 times greater, has suffered more confirmed fatalities from the virus than Britain, according to data so far. Meanwhile, in China, youngsters in the global virus epicenter of Wuhan filed back to class this morning, wearing masks and walking in single file past thermal scanners. Senior school students in 121 institutions were back in front of chalkboards and digital displays for the first time since the city shut down in January. Teenagers sat at individual desks spaced a meter apart, seeing their teachers in the flesh after months of distance learning. Only senior students who are prepping for upcoming exams are back at school. Return dates have not yet been confirmed for junior and middle school students. And amid the loosening grip of COVID-19 across some parts of the world, people are trickling back to Bangkok's famous Erawan Shrine amid relaxing coronavirus restrictions in the Thai capital, with the devout once again wishing for good health and fortune. The shrine was closed for more than a month, reopening with dancers once again performing in worshipping ceremonies in folk outfits with face shields as a precaution. And that's all we have in today's edition of Tracking COVID-19. But before we wrap up, we'll leave you with this video in which Bollywood celebrities Virat Kohli, Ayushmann Khurrana, Kriti Sanon and Sara Ali Khan pledged support in the fight against fake forwards on social media. The celebrities urged people to stop forwarding videos which do not have verified information as we do. Let's take a look. Namaskar.
यार मेरे कजन की वजह से ना पूरे घर में फैल
एक एक करके ना सब लोग इसके चपेट में आ जाएंगे।
एक लापरवाह टच से लाखों तक पहुंच जाता है।
और एक बार ये महामारी फैल गई ना बॉस, उसे कोई नहीं रोक सकता।
जी हाँ, हम बात कर रहे हैं उन फॉरवर्ड्स और वीडियोस की जो नफरत और अफवाहें फैलाते हैं। ये भी हमारे समाज का एक वायरस है।
उत्तर दिशा में सोने से डायबिटीज ठीक हो जाता है।
देखिए लोग कैसे देश को बर्बाद कर रहे हैं। ये वीडियो 10 लोगों को फॉरवर्ड कीजिए, गारंटी लड़का। ऐसा करने से ना कैंसर ठीक हो जाता है, वैसा करने से ना भूकंप आ जाता है। ऐसे वीडियोस और मैसेजेस फॉरवर्ड नहीं होने चाहिए और बनने भी नहीं चाहिए।
जब भी आपको कोई ऐसा वीडियो मिले, कोई ऐसा मैसेज दिखे जो आपको सही ना लगे,
अगर उससे किसी का नुकसान हो सकता है,
अगर सूचना सीधा गवर्नमेंट से नहीं है,
तो उसे मत कर फॉरवर्ड।
और देखोगे कि ऐसा करने से तुम सेफ रहोगे, लोग सेफ रहेंगे और देश सेफ रहेगा। तो
मत कर
फॉरवर्ड।
मत कर फॉरवर्ड।